All insurance companies have medical policies or policies that give the rules, if you will, or outline information regarding the services for which they pay. Example would be specific to chiropractic for us, right? United Healthcare, theirs specifically deals with the services, not all services, but some services, and their policies center around mostly in the manipulative therapy policies. Now, Blue Cross Blue Shield, on the other hand, kind of does a larger grouping for the chiropractic profession as a whole, and the title of their policy regarding those services, most of the services that we render, are chiropractic care services. And if you have not reviewed that document, we strongly urge you. They began to produce a document from Blue Cross Blue Shield anyway, about 2018. They update it on a fairly regular basis. For example, when the time therapy code changes took place a few years ago, they made changes to the document then. And then, of course, at the beginning of 2021, when E&M code changes occurred, they updated the document again there. But they do annual updates to the document as well. I wanted to go over a couple of key items, things you want to be aware of. We're going to cover these over the course of a handful of weeks because we want you to be aware. Now, just because these are policies within Blue Cross Blue Shield doesn't mean that they only apply to Blue Cross Blue Shield. In some cases, these are going to be good things to implement in your practice across the board. But we always encourage you to look at all of the policies surrounding the services that you offer in your practice for each one of your insurance companies. So what are the key things that are covered in some of these policies? Well, it could be documentation standards, coding standards, diagnosis codes, information about specific services, coding reminders. In fact, in the Blue Cross Blue Shield one, they even include some DME and imaging information as well. Some important key pieces of information that you need to be aware of. So let's talk specifically about some things that they call out in regards to the documentation standards and coding information surrounding the CMT codes, or the 98940, 98941, 2, and 3 codes. So all of the spinal codes, as well as the extra spinal manipulation code with 98943. Here are the things that they lay out that they indicate are critical. Let's talk first and foremost about your claim form. On the 1500 claim form, you have to make sure that you include a diagnosis code that incorporates all of the regions for which you're billing. So for example, if you're billing a 98940, it only requires one. So you got to make sure that you have a minimum of one spinal related diagnosis code. If you have a 98943, you want to make sure that you have a minimum of one extra spinal or additional joint manipulation or a joint region, if you will, that you are adjusting with a 98943. However, when we get to the 98941 and 2, those obviously are additional regions. So for 98941, there has to be a minimum of diagnosis codes that cover a minimum of 3 regions. So the way that they state that specifically is you must have an ICD-10 code. For 98941 specifically is the example that they give. You must have an ICD-10 CM code that incorporates at least 3 different regions. By the way, on 98942, then you would have to have 5 different regions covered with your diagnosis codes. That's going to be really important, especially with the recent includes one changes that they implemented. And if you've seen some denials coming from Blue Cross Blue Shield that are related to your diagnosis code, make sure that you check out our article that previously we published. We'll include a link in this description to that article, specifically in regards to the excludes ones. But again, it's really important on your claim form, make sure that you cover all of the regions that you're adjusting in the diagnosis codes. Now, what must the documentation include for CMT codes? Well, one is you have to have the location. That seems rather obvious, and I'm sure that all of you are doing that. You have to have specific regions that you adjusted, of course, no doubt. But also you have to include the technique that you use. That is actually a requirement laid out inside their medical policy, is not just the region that you adjusted, but also the technique that you used for the adjustment. One thing that we always talk about is outcomes assessments, right? So Another item that you have to include in your documentation is the response. So what's the patient's response to the treatment, the adjustment, including whether or not the pain or condition being treated increased, reduced, or eliminated the problem. So that is going to be another key component. Now, last is really interesting, and this is what they indicate, that each manipulation reported, each CMT reported must be related to the patient's complaints and a relevant symptomatic spinal or extraspinal level. So that's another key one. Key takeaways for today: make sure that you have diagnosis codes that clearly reflect all of the regions that you're adjusting. It's very critically important. Make sure that your documentation includes the technique used, the patient's response, and that it's all specifically related to a patient complaint. Actually, the way patient complaint and relevant symptomatic spinal or extraspinal levels. So hopefully this information helps you out. We'll include a link to Blue Cross Blue Shield's policy and the policy for United Healthcare inside of this video description. Catch you next week.